now we're going to move on to Barbara Neuwelt. So welcome, Barbara. Barbara Neuwelt is currently completing her work as Senior Policy and Research Analyst at the Mental Health Strategy Team at the Mental Health Commission of Canada. And she's going to be talking today about the strategy and mental health promotion and mental illness prevention. So over to you, Barbara.
Hello, everyone. So I'm going to be talking briefly about the 4 relationships between mental health, mental illness, and chronic disease. And then I'll talk a bit about what we mean in the mental health strategy by mental health, mental illness, mental health promotion, and mental illness prevention. And then I'll give you a very high-level overview of the mental health strategy for Canada. You're welcome to ask more questions, but I'm just going to be very brief. And then some examples of mental health promotion and mental illness primary prevention initiatives. The examples are, some of them may be included in the strategy, but they're drawn from best and promising practices. So there are 4 aspects to the relationship. Mental illnesses are sometimes perceived as chronic illnesses in and of themselves. This is controversial. In addition, there's high risk of comorbidity, and finally, poor mental health is a risk factor for chronic disease. So the first question often comes up is, are mental illnesses preventable? And they aren't in the same way that physical illnesses are, but we do know that we can enhance protective factors, reduce risk factors, reduce the onset of some mental health problems and illnesses, and we can certainly reduce symptoms and disability, which is more what John will talk about, and we can support people in their journey of recovery. So what do we mean by, let's start by clarifying some terms. The World Health Organization says that mental health is more than the absence of mental illness. In the mental health strategy, we say that mental health is different from the absence of mental illness. And this is because many people with mental illnesses can in fact experience good, positive mental health. If we think of mental health as resilience, holding a positive outlook, being able to function well in one's life, people with mental illness living in recovery can be doing all of that. When we talk about mental health problems and illnesses, we're talking about patterns in thinking, behavior, or emotions that are causing distress and impairment in some way in daily living. So how does the Mental Health Commission understand mental health promotion and mental illness prevention? The goal of mental health promotion is to improve our positive mental health. It addresses the whole population, and action must be taken on multiple levels. Mental illness prevention, on the other hand, has the goal of reducing the incidence, prevalence, or impact of mental illness. And the focus here is on populations at risk of mental health problems and illnesses. So one way to think of this is to think of mental health and mental illness as being on 2 different continua. Instead of mental illness at one end and mental health at the other, we have mental illness at one end and no mental illness at the other. On the second continuum, we have optimal mental health and poor mental health. So if we think of primary prevention as moving a population to the right, and mental health promotion as moving people up or to the north, you can see that this may involve different approaches. On the other hand, it may also involve approaches that do both, moving people further up on both continua in the upper right quadrant. It's important to note here that you can have poor mental health with no signs of mental illness. And the population health approach should recognize that there are possibilities for moving everyone further north and further to the right. Let's look briefly now at the mental health strategy as a whole. We take a comprehensive approach from people with mental illness to those with emerging problems, to those at risk, and to the whole population. There are 6 strategic directions in the mental health strategy. And mental health promotion and mental illness prevention are integrated into many of the strategic directions. The first one is about promotion, prevention, and early intervention in everyday settings, homes, schools, and workplaces. The second strategic direction focuses on recovery and rights, the rights of people with mental health problems and illnesses. The third strategic direction is about improving services for people with mental health problems and illnesses. Not just mental health services, but housing, employment, income, and social support. The fourth direction focuses on reducing disparities and addressing diversity. so a big focus on health equity. The fifth addresses the needs and strengths of First Nations, Inuit, and Métis peoples. And the sixth one is about leadership and infrastructure. I'm going to touch briefly on three of the strategic directions, although they all have a bearing on promotion and prevention. Strategic Direction 1 has four priorities. The first is to increase awareness and understanding of promotion and prevention in the whole population, as well as in workers across sectors that work with vulnerable populations. So increasing people's understanding of what is involved in promoting your health, how to recognize mental illness or mental health problems, and how to get help. The three other priorities focus on populations, children, seniors, and the workplace. Strategic Direction 4 focuses on reducing disparities and strengthening the response to diverse needs. There are five priorities. First is to address the social determinants of mental health, and then specifically to address several population groups: immigrants, refugees, ethnocultural and racialized groups, northern and remote communities, Francophone and Anglophone minority communities, and then to address gender differences in mental health, the different risk factors for men and women, and addressing the lesbian, gay, bisexual, and transgender population. The sixth strategic direction has some bearing on health promotion and mental illness prevention. Specifically, there's a focus on whole of government and cross-sectoral coordination, which is very important since promotion and prevention are about both addressing mental health in everyday settings and addressing the social determinants of health. They have to be addressed outside of the health system as well as within it. To do so requires cross-ministry and cross-sectoral work. Infrastructure support and leadership are also needed for promotion and prevention. So that's the high-level overview of what's going to be in the mental health strategy. And now I'll move on to some promising practices in mental health promotion and mental illness prevention. So one aspect of Strategic Direction 1 is around increasing awareness. And there is a campaign in the United Kingdom to raise awareness about how to promote positive mental health. It involves 5 evidence-based messages about what individuals can do to improve their own mental health, and also communities can organize around these messages. The messages are, for example, connect with others, be active, take notice, keep learning, and give. There's also been some work done in the UK on how to apply the concept of people being able to address their own mental health to marginalized communities. And there's some research that's been done about the benefit of it as long as people are involved in developing appropriate messages. The second example from Canada is Healthy Child Manitoba. This is an initiative that involves 7 different ministries at the cabinet level, Healthy Child legislation, and a cabinet priority. The initiatives include things at the policy level, programs that are rolled out across the whole province, and support for local community networks of parents and providers to develop their own initiatives. You can look at the Healthy Child Manitoba website for details, but it's a good example of cross-sectoral support for to address children's mental health. One of the programs that Healthy Child Manitoba has initiated, and it's also in Alberta, and I believe it's spreading, it also exists in many other provinces in Canada, is the PHAC program, which originated in Australia and has 25 years of research to back it up. The focus of PHAC is to support parents. It's both a prevention and a promotion initiative. The intention is to prevent severe behavioral, emotional, and developmental problems in children by enhancing the knowledge, skills, and confidence of parents. There are multiple levels to this, from the provision of media messages on positive parenting for the whole population, to brief information resources, to brief targeted interventions for specific behavioral problems, to more intensive parenting training that target broader family issues, such as relationship conflict and parental depression. One of the features of Triple P is that it's adaptable for both urban and rural communities because it uses telephone and other methods in addition to face-to-face. The last three examples on this page are school-based initiatives. All three programs aim to promote social and emotional learning of children and have shown outcomes in terms of reducing aggression and violence amongst children. So these programs are the Roots of Empathy, PATHs, and the fourth R. The Roots of Empathy and PATHs are both for elementary school. The fourth R is for middle school and high school. The Roots of Empathy brings a parent and a baby into an elementary school classroom every 3 weeks all year, and through discussing the feelings of the baby, the children get in touch and learn to express their own feelings. PATHs is a continuous curriculum for all children that they follow from kindergarten to grade 6, and the teachers are trained in the curriculum, and the focus is, as I said, around promoting and training children in social and emotional competency. The fourth R is a curriculum that's been developed it's been developed by and for teachers along with other experts, and it's based on the requirements of the curriculum in Ontario, and it's also been adapted for other provinces. The focus is on supporting adolescents to form healthy relationships and make better choices while they navigate the critical developmental issues of adolescence, such as substance use, sexual relationships, bullying, and violence. So those are some examples that I see as more on the promotion side, although obviously they overlap with prevention. Some specific prevention initiatives. Mental health first aid was an Australian program that has now been adapted for Canada and is operated through the Mental Health Commission. It's a 2-day training for the general public that parallels physical first aid. People learn how to recognize the signs of mental health problems, how to help, and how to get professional assistance. It's also been adapted for different populations. Hong Fook, a Southeast Asian mental health agency in Toronto, has developed a training program for settlement workers so that settlement workers can recognize signs of mental health problems, can learn how to help, and also to understand the social determinants of mental health in immigrants and refugees. So this is a prevention program that really trains settlement workers to be able to do prevention and early identification and to have some understanding of mental health issues in the population they serve. Canada is developing psychological health and safety standards. So just as we have occupational health and safety standards that each workplace is expected to follow, these standards will be voluntary standards, and the goal is to prevent mental health injuries in the workplace. So to address whatever factors there are in the workplace that can provoke or create problems for people. Another program for seniors. In Edmonton, a partnership has been developed between mental health services and home care to support home care workers to recognize when seniors are at risk of mental health problems or illnesses and to ensure that there's early intervention for those who are beginning to exhibit signs of problems. And the final example is Friends for Life, which is a school-based anxiety prevention program for children who are experiencing fears, worries, and depression. The program builds resilience and self-esteem and teaches cognitive and emotional skills in a simple, structured format. So those are some examples of some primary prevention programs.
So our next speaker in today's presentation will be Amanda Sloanwhite. Amanda is a policy